सो हेलो एंड वेलकम बैक टू माय यूट्यूब चैनल। कैसे हैं आप सब माय डियर फ्रेंड्स? आई होप आई ऑल यू आर डूइंग वेल। बहुत अच्छे से पढ़ रहे होंगे और आप लोग। सो टुडे आई वांट टू डिस्कस विथ यू ऑल अबाउट सीजोफ्रेनिया और द मोस्ट इम्पॉर्टेंट थिंग, द मोस्ट इम्पॉर्टेंट टॉपिक्स और द मोस्ट इम्पॉर्टेंट lines about schizophrenia. I know you all have some much knowledge about schizophrenia, but today I want to discuss some topics about schizophrenia. So, guys, what topics should you know about the schizophrenia? First one is, what is schizophrenia? Schizophrenia means split of mind. Okay, split of mind. So in schizophrenia, split of mind may in what you see, what you watch, what type of split of mind. So in the split of mind, the patient who is suffering from schizophrenia, his emotion disturbance, split of emotions, split of thoughts, split of cognition. These three words are having split of mind. Okay. Then next, what should important point, what are the important point you should know about schizophrenia? Is schizophrenia in which the Bleuler, है ना, E for Emil Kraepelin, in the very earlier Emil Kraepelin has given the name schizophrenia as a dementia precox. After that, or after so many researches, the Eugen Bleuler has changed the term dementia precox to schizophrenia. Okay, so that's the reason from where dementia precox is changed to schizophrenia. Okay, that is we also known as split of mind. After that, the Bleuler has given 4A symptom. What are the 4A symptoms of Bleuler? First one is ambivalence, second one is loosening of association, third one is autism, fourth one is affective disturbances. Person who is suffering from schizophrenia has disturbed affect. What type of disturbed affect? Labile affect, है ना? The person have inappropriate affect. The person have blunt affect. The person may have another type of affect which is flat affect. Flat affect means no affect. Blunt affect means decrease intensity of blunt affect. Okay. Next one is, what type of ratio you should know in the schizophrenia. In the schizophrenia, male female ratio is 1 is to 1, my dear friends. Okay. Next one you should know about the schizophrenia. The etiological factor, causative factor, causes, है ना? What are the causes of schizophrenia? Why the schizophrenia occurs in male or female? So first one is increase the level of dopamine. Okay, what is dopamine? Dopamine is an hormone which is secreted in your brain. So increase, when the increased level of dopamine in the patient's brain mind, at that time the person can may suffer from the schizophrenia. Increased dopamine. Next one is, what type of neurotransmitters? Next one is increased level of serotonin, increased level of norepinephrine. Okay. Next, what type of genetic factors which may cause schizophrenia? So, in the genetic factor, you should know 1% sibling can affect 8%. है ना? One sibling. If one sibling have, or his or her siblings have history of or have schizophrenia, so they may get 8% chances of get schizophrenia in future. One parent is equal to 11 to 12% schizophrenia chances. Next one is, if both parents suffering from schizophrenia, so 40% chances their child may get schizophrenia in future. Next one is, Neurological factors. Next one is in neurological factors. Enlargement of third left lateral ventricles. Enlargement of third lateral ventricles. Next, the etiological factor is interpersonal model. In interpersonal model, focus on relationship between mother and child. Focus on relationship between opposite sex. Okay, mother and child, mother and son. Next one is psychoanalytical theory. In psychoanalytical theory, Freud told has fixation of oral stage. Okay, the Sigmund Freud has given the theory about the fixation of oral stage. The person cannot get next stage like anal, phallic latency. Okay. Next one is diagnosis of schizophrenia. Before the diagnosis of schizophrenia, we should know about the environmental factors which may lead schizophrenia in a person. So, obstetric complications की वजह से भी the person may get schizophrenia. Abnormalities in developmental milestones. If a child have abnormal developmental of milestone, so they may also have in their future schizophrenia. Next one is prenatal malnutrition. Next one is drug abuser. If a mother has drug abuser habitude, these all points can lead to schizophrenia. Next one is how can you diagnose a person that suffering from schizophrenia? So first one is patient have delusions. Patient can get has hallucinations, disorganized speech, disorganized behavior, and negative symptoms. If a person suffering from these all, you can diagnose a person as a schizophrenia. Okay, my dear friends. Next one is there are so many type of schizophrenia, but ICD-11 according to now we have only one type of schizophrenia, or the super most type of schizophrenia is catatonic schizophrenia, catatonia schizophrenia. Okay, there are so many type of delusion, there are so many type of hallucinations also. Okay, next one is you should know that how much type of delusion or hallucination. If you all are don't know about delusion or hallucination, I will teach you in another class about delusion and hallucination. Next one is what type of treatment we should give the treatment of the patient of schizophrenia. So treatment is only based on important typical antipsychotics and atypical antipsychotics. The treatment poor compliance and more side effects, also suffering. Okay, patients have suffered from more compliance and more side effects. Typical antipsychotic, also known as D2 blockers, dopamine blocker, because in the earlier we know that increased level of dopamine can lead to schizophrenia in a patient. So in typical antipsychotic you can give the patient HPL, that is haloperidol, droperidol, trifluperidol, and phenfluperidol. Okay, my dear friends. Next one is chlorpromazide you can give, and flufenazine you can give to the patient who is suffering from schizophrenia in the typical antipsychotic. In the atypical antipsychotic, you should know that it is also a D2 receptor blocker and short period of time. So because of short period of time, this type of education is this type of drugs are have minor or milder type of side effect. Okay, which is also known as extrapyramidal symptoms. Okay, so these all are about schizophrenia. Next, we should know about the what is extrapyramidal symptoms. In extrapyramidal symptoms, there have akathisia. Next, what is the symptoms of coming under the extrapyramidal symptom, that is tardive acute dystonia, neuromalignant syndrome. This all points come under the extrapyramidal symptoms. We also have non-pharmacological treatment for schizophrenic patient. First one is token economy. Next one is individual psychotherapy, group psychotherapy, supportive psychotherapy, cognitive behavior therapy. That is CBT. First rank symptoms, top rank symptoms. What are the first rank symptoms? First rank symptom is thought insertion, thought withdrawal, thought broadcasting. This all. The most important topic and the most important type of schizophrenia is catatonia. Catatonia schizophrenia. In the catatonia, the symptoms like echolalia, echopraxia, patient may suffer from echopraxia, rigidity, automatic obedience, okay, cataplexy, flexibility like symptoms patient may have, ambivalence, ambitendency, negativism, posturing. These all symptoms about the schizophrenia patient may get face. Treatment is not very much clear, but we should give GABA and glutamate and IV lorazepam for the catatonia schizophrenia, and we can also give the most important and the very useful treatment is extra electroconvulsive therapy, ECT. Okay. So this all about schizophrenia. सो गाइस, आज ये जो टॉपिक था अबाउट स्किज़ोफ्रेनिया वो उन लोगों के लिए है। ये टॉपिक मैंने ये सब इसलिए बोला है, इसलिए बताया है आप लोगों को स्किज़ोफ्रेनिया के बारे में। आई शुड और आई कैन गिव यू नोट्स ऑल्सो अबाउट स्किज़ोफ्रेनिया, बट नहीं, आई एम मेकिंग वीडियोज फॉर दो स्टूडेंट्स हु आर नॉट गेटिंग टाइम टू रीड, टू स्टडी, है ना। तो ये आप लोगों के लिए है माय डियर फ्रेंड्स, जिनके पास टाइम नहीं है पढ़ने का, who don't have time to make notes, their personal notes. So for those people, this is a very important topic of mental health nursing is schizophrenia. Please listen, watch and remember my dear friends, you don't need to make a pen, you don't need to make a notes. Okay, you have to only listen very carefully, and surely after this video your schizophrenia topic is clearly clear, and आप अगर इस वीडियो को एक दो बार और सुनेंगे तो आपका schizophrenia टॉपिक याद हो जाएगा। ठीक है माय डियर फ्रेंड्स, next we are going to do, or next we are going to discuss about some glossaries about the mental health nursing. Okay, my dear friends, thank you. Thank you for watching. Keep study, my dear friends, because NORCET examination is coming very, very, very soon. All the best to all of you. Thank you. Thank you so much, my dear friends. Thank you for watching.